Welcome back. It's Sun Safety Week and a great time to remind you to keep your skin safe from those harmful UV rays. Here with some great prevention tips is Dr. Todd Schlesinger of the Dermatology and Laser Center of Charleston. Welcome.
Thank you.
Yes, thank you for joining us. Now we're talking about this because this is the time of year that you could be out in the sun overexposing yourself to these UV rays. What are the most important things to remember about being safe in the sun?
Most important things we always tell people are to wear sunscreen, to wear protective clothing, and to seek shade out in the sun. Skin cancer is definitely a rising problem in the world, and we're trying to get everyone to wear sunscreen and also to check their bodies out.
Yeah, now when you say check the bodies out, what are some things that folks need to be looking for or have their maybe, spouse look for?
Well, the one thing we tell people to look for is they want to look for any lesion on their skin that's changing. So for example, if they have a little mole or a lesion on their skin that's been there for a while, but it's changing over time, that's a concerning sign.
Definitely, because we were talking during the commercial break, and I had a basal cell actually removed from my shoulder from too much exposure when I was young. Didn't really think about it. Back then, people were like, they weren't lathering up the kids as much as they were nowadays. And so I had to get that cut out, and it's something you don't want to go through.
No, you could try to avoid that. I mean, that's the last resort, but cutting it out, basal cell, is certainly something that can cure that. Basal cell is the most common kind of skin cancer in this country. It occurs about 1 million times a year.
Now, let's talk about the different types,
yeah,
so folks can know what they're dealing with and what to look out for.
So, as I said, basal cell is the most common type, 1 million times a year in this country. It's probably the most common type of cancer overall.
Okay.
The second most common form is called squamous cell carcinoma, and squamous cell carcinoma occurs about 400,000 to 500,000 times a year. It comes from a little bit higher level in the skin, but it's a little bit more dangerous. The third and most dangerous kind is what we call melanoma, and that's what we watch out for mostly. On the screen, I believe, are some images that we've sent over. The top left corner, you may see a mole that looks like a little irregular. It may have abnormal color. It may have changed with time. It may be what we say evolving. We tell everyone to watch out for what we call the A, B, C, D, E. So this is the key thing to remember.
Okay.
Asymmetry, border, color, diameter, and then evolution or change with time. If you see something changing with time, see a dermatologist.
You definitely want to keep an eye on it. Now, how treatable is skin cancer, and what can we do to protect ourselves?
Luckily, skin cancer is quite treatable if caught early. Basal cell and squamous cell don't spread very often. In fact, basal cell almost never spreads. Squamous cell spreads a little bit more often. In fact, if it's located on the ear or the lip, it has a higher risk of spreading. Melanoma can spread easily, and since melanoma, if it's caught early, it can be cured with a 99% chance it'll never come back again.
And you just pointed out something that's real key, is you don't think about the ears when you're out at the beach putting on the suntan lotion, but the ear is very susceptible. And behind the ears, obviously that's a troubled spot. But what other areas should folks make sure that they look out for and protect more than others? Well,
here's a couple different areas. First of all, in females between the ages of 15 and 29, skin cancer on the trunk is the fastest rising type of cancer in that age group. The reason why we're seeing that is tanning bed use. We're seeing tanning beds, so we're very concerned about that. The U.S. Department of Health and Human Services has basically come out very clearly stating that ultraviolet radiation of any type is a cancer-causing problem. And avoiding ultraviolet rays is the number one most preventable way to prevent skin cancer.
Right, and they're cracking down on the tanning beds now.
They are.
Yeah.
Legislation is currently being looked at to try to regulate the tanning bed industry to make sure that if it is going to be there, it's going to be as safe as possible, that people understand the risks of getting involved.
And so basically prevention is the key. And this starts as soon as your child, if you have a young child, starts going out in the sun. We all see the products out there at the store. 50 protection, 30. What needs to be put on to protect yourself? What is the best?
The key thing about sunscreen is apply early, at least 30 minutes before you go outside. Reapply. Most people don't reapply. Most people don't apply enough.
Okay.
And most people don't cover up and seek shade during the key 10 to 4 o'clock hours of the day when the sun's rays are coming down the worst. But about sunscreen, we want to see everyone using at least a 15 and preferably a 30. Okay. Going to much higher numbers gives you minimal additional protection. You're getting 97% protection if you're using a 30, and that's probably where you ought to be.
The 50s and the 75s are pretty much the same as the 30.
Pretty much the same as the 30. You may get a percent or two, but you're also adding a lot of ingredients in order to get that extra 1 or 2% protection.
You'll get that warm, fuzzy feeling, thinking you're protecting yourself more, but not really. So where can our viewers go to learn more about these tips and UV protection?
A couple of places they can go. They can, of course, go to our website. We have put a lot of information on there. It's www.dermalaser.com. or they can call the office. The number's there. It's 556-8886. Another resource is the American Academy of Dermatology, and the website there is www.aad.org. So it's very simple, American Academy of Dermatology, or our website has all the information as well.
And again, it's so important to get this early, so if you even think that you have something that is irregular, get it checked out. All right, thank you so much, Doctor, for stopping by.
Thank you.
All right. Well, after the break, Spoleto's Brooklyn Rider is here, and we'll give you a sneak peek at their final performance. You'll want to stay with us.